Good morning, Aya. Is this your partner you've brought along with you?
Yeah, this is Ben.
Nice to meet you, Ben. My name's Alexandra. I'm the midwife helping to look after Aya. So, Aya, you finally made it 25 weeks. Congratulations. Baby must be pretty wriggly in there by now.
Sure is. Super regular too. Always wriggling when I've eaten or I'm trying to get to sleep.
Perfect. It's really good that you're getting to know your baby so well and what's normal for their baby, so that if something changes, you can let us know straight away. Now, I've noticed that since your last appointment, you've done an ultrasound, some bloods that were missing, and also the glucose tolerance test, which has come back a little higher than we would have liked. Have you talked through the results with anyone yet?
Someone called me and said my sugar test was high, so I have to go to the diabetes education clinic on Thursday. They told me that I need to be really careful with my diet or else they'll have to put me on some medication.
Yeah, sounds like you've already given it some thought then. Is it all right if I chat a little bit about it today with you?
Yeah, of course, that's fine.
Awesome. So tell me, if you imagined a scale from 1 to 10, how important is it for you to manage this gestational diabetes just with your diet and not with medication?
Probably like an 8.
Wow, that's actually quite high. Is there any particular reason that it's not something like a 3 or a 4?
Just kind of is, I don't know. I guess it's because I want my baby to have the best start, even though there's so much that I'll need to change to make that happen.
Yeah, it really is a good thing that you're not just making the changes for you, but also for your baby too. Obviously, we're here to support you through this whole process. So why don't we start with what you guys already know about gestational diabetes, or GDM?
Well, I know at my booking visit, they looked at my BMI, which they said was 37, and then my age, which is 42, and then also Dad's history of diabetes. So that then put me at a higher risk for diabetes. And then they also said that because of my nationality, that would also maybe have an effect, which is why they sent me for a blood sugar test. But I'm not 100% sure how that one works because I didn't have to drink the sugar drink or anything for that.
Yeah, so that one's the HbA1c. So essentially, that's an early test that looks at the average amount of glucose sugar that's attached to the hemoglobin in your red blood cells. And because red blood cells generally last for about 3 months in your body, it gives us an average of those sugar levels over the last 3 months. Even though this test wasn't diagnostic, it gave us a pretty good idea that your body wasn't managing all the hormonal changes of pregnancy and that you might need to start monitoring your diet. And that, as they said on the phone to you this week, your oral glucose tolerance test results were high, which also confirms that you have gestational diabetes. GDM can happen in pregnancy due to the hormonal changes, which affect each woman differently, depending on age, nationality, genetic disposition, family history, and BMI. And like you already pointed out, you did have a few compelling risk factors. So that's why we got on top of everything so early.
Yeah, I know for sure she was gonna get it from the test. And that's the same as the midwife told us at the booking visit. It's not a huge deal, is it? Because so many people get it. It can't be that bad.
Well, basically what it means is that now you have to monitor your sugars and work to keep them normal by making a few lifestyle changes. And this is because if your sugars aren't well controlled, the GDM can actually have a negative effect on baby, either causing it to grow too big or causing it to become so used to the sugars in its bloodstream that are higher than normal that once it's born, it doesn't cope with being away from that high supply, and therefore it drops its sugars and may need to be admitted to the NICU for monitoring and treatment.
Okay, so it does matter.
Yeah, it's definitely something to keep an eye on, but it doesn't dictate or change the whole pregnancy. Like, if you monitor your sugars well, you can still be seen by the midwives for every appointment, and your birth plan isn't affected either.
So does that mean I could still have like a water birth or use different pain relief drugs if I wanted to?
Yeah, absolutely. It's definitely not something that you need to feel overwhelmed by because you'll have support every step of the way. You mentioned earlier that it's important for you to manage this GDM without needing medication so that you can give your bub the best start. What sort of things do you think will help you to do this?
Well, I haven't made any changes yet, but I know that it's important and I definitely wanted to stick to the recommended weight gain for this pregnancy. They told me at booking that I shouldn't gain more than 5 to 9 kilos. Is that right?
Well, as you know, your BMI was higher, which was an initial risk factor for the GDM. The higher BMI on your yellow card shows that even before the GDM diagnosis, the recommended weight gain for the whole of the pregnancy was actually 5 to 9 kilos. When you think about the baby weighing about 3 kilos at the end of pregnancy, the extra half a kilo of blood you've got, and the extra volume of the breast tissue and all of that other extra tissue that I'm sure you've noticed these past few months, that's really not that much. So was there anything in particular that has prevented you so far from sticking to that weight gain, even though you really wanted to?
Well, my first trimester was pretty miserable, so it kind of just slipped down my priority list. And this pregnancy has actually become kind of an excuse to eat more because, like eating for two and all that.
And I haven't been helping with that either. When we both work and have the hospital visit and really busy lives, a quick call to order Thai food or some other kind of takeout is the way we go to.
Yeah, I totally get that. Good on you, Aya, for setting the goal of sticking to that recommended weight gain, and to both of you for identifying areas that you could change. Right there in that conversation, you've basically made the first step. What do you feel is the next step in achieving these goals?
Well, I actually really love the idea of meal planning, but I've never got that ball rolling. I guess this is the perfect time to start. And like a steak and salad is easy and healthy if it's all there waiting. So if we can plan out a week's worth of dinners and then go grocery shopping just once a week to buy everything I'd need so it's all there and planned for when we get home, I think that would be really helpful.
That sounds like a really practical step to take. And as part of the diabetes education clinic you'll be going to next Thursday, you'll get to see a nutritionist who'll also give you all sorts of tips about the types of food to avoid, which ones to include, along with what times to schedule your meals and help maintain your blood sugar levels throughout the day. There's also a whole heap of substitutes you can incorporate into your diet so that you can eat the foods you enjoy without all the extra sugars.
Yeah, I mean, that's feasible for us, especially because I'm here to help out with everything now because I'm working from home. I've seen those low GI rice in a supermarket that her dad has mentioned a few times. A stir fry with some of those low GI rice will only take about 10 minutes. And we can get some frozen stir fry veggies to chuck in the pan with some chicken breast and maybe a small dash of soy sauce and sesame oil.
Exactly. Anything else you can think of that you want to set as a goal or a strategy for yourself to monitor your weight gain and maintain that target weight gain this pregnancy?
Well, I enjoy going for walks, and we have this crazy dog at home. So I think both me and the dog would really appreciate some extra exercise each afternoon, even if it's just for half an hour walking around the block. And Ben and I could use the extra time together as well.
For sure. And Ben, you're already coming up with some really helpful ideas. Your job is to motivate and to keep Aya accountable, okay?
Gotcha.
Okay, so we've got a plan. Now, when and how are you going to make it happen? Walk every night is pretty self-explanatory, but I suppose, are you going to go somewhere nice or do the block? Before or after dinner, or when you first get home? When are you going to sit down and actually make the meal plan and do the groceries, etc.?
Well, we have Heffron Park, which is near our house, and it's well lit and paved, and it's quite pretty, so we can walk there after dinner each night.
Yeah, then we could meal plan on a weekend. Like if we plan Sunday morning, we always head out Sunday, so we could factor in a grocery shop while we are out.
Such a great plan. And Aya, I know you pointed out earlier that all of this is going to be a pretty big lifestyle change for you guys. But like you said, there are some significant benefits, not just to you, but also for baby and Ben too. I'm going to pop all this in our notes here so that way next time we see you, we can check in and just see how it's all going. Does that sound all right?
Yeah, for sure. And obviously we can be adding to it after we see the education clinic, because I'm sure they'll give us heaps of tips there too.
Exactly. There's also a program called Get Healthy in Pregnancy, and that's a free phone service that has some really great ideas for keeping on top of your diet and exercise plans, all from the comfort of your own home.
It sounds familiar. I think they said they were going to refer me to that at my booking, but I haven't heard from them.
Okay, we still keen to make use of that service?
Yeah, for sure. I mean, especially now I have a proper reason to actually make some changes.
Yeah. It's clear that you can see how managing your sugars will be beneficial for the whole family, and you've also highlighted that for you, the 2 keys to achieving that goal will be to involve pre-planning healthy meals and doing regular exercise together. It sounds like Get Healthy in Pregnancy will actually be a really helpful tool to give you some extra inspiration for the healthy meals and also ways to incorporate exercise into your lifestyle. Maybe that extra little bit of motivation too. I'll follow that up and make sure they get in contact. I'll also just give you a flyer for it too, in case you've lost the other one.
That would be really great. Thank you so much.
No worries. So all the best, you guys, and I'll see you at next visit, okay?
See ya.